The countdown to Easter is on, and today we have Dr. Victoria Brotzman from High Point Smile Dentistry with how to protect your teeth while enjoying your sweets and whatever dental questions you may have. So like this person right here, they say, I have black marks on the tops of my back teeth. They don't hurt, but I'm concerned. What could it be?
So those black marks that you see on the grooves of your teeth, they could either be two things, stains, or they could be cavities. So I would just get them checked out by your dentist, get x-rays, get your exams every 6 months.
So when you get an exam, can you tell that there is a cavity?
Yeah, so in our exams, what we're doing is we're seeing in the x-rays if the cavity has reached that second or middle layer of your tooth, but then we're also seeing if that area is soft. So cavities will oftentimes be soft, and we can feel that with our instruments.
Okay, and would we be able to feel that as the patient?
Not usually. If you're able to feel it if you're able to feel the softness of your teeth, it's a bigger cavity.
Okay. So let's talk about flossing. We've had a lot of questions about this, even in our own newsroom. Are those picks just as good as the actual floss string?
I will say the floss string is the best just because you can use it and go around and kind of hug each tooth side by side. But if you are not flossing at all and the floss picks are the only thing you're going to use, I say floss picks are better than not flossing at all. But really, to make sure you are doing the best job possible, the floss string is best.
Okay. But floss, whatever way you're going to floss, at least floss, right?
At least floss, yeah.
Well, we've got a question that kind of deals with that. This person's asking, do those water tools replace the need for flossing?
I recommend those water picks that you can buy in special situations. People with bridges or implants are really great for, reducing that food impaction. But again, the regular floss is better. If you're using that water flosser, I would just do it in addition to actual flossing, not in replace of.
Okay. And somebody's asking, I have purple marks on my gums. Is this a reason for concern?
So it depends what that purple mark looks like. A lot of times we do have pigmentations that show up in our gums, and that's completely normal. But without me actually looking at you, I can't tell you whether that's normal, but there are some pigmentations that people can have in their gums that are normal.
Mm-hmm. Okay. This person's asking, hey, what's the best way to get rid of bad breath?
Get your regular cleanings every 6 months to get rid of bad breath. Drink lots of water. A lot of times it just comes from dehydration. And then mouthwashes can help, and sugarless gum can also help. But a lot of times it's dehydration and not getting regular cleanings.
Gotcha, because it just builds up and there's all that in there. So is there a certain kind of mouthwash that we should or should not use?
My personal fave is the ACT mouthwash. The one that has fluoride in it is going to be the best at protecting your enamel long term. But any mouthwash that doesn't have any alcohol in it. So I just recommend no mouthwashes that have alcohol.
Okay. This person's asking, do over-the-counter bleaching products work?
Yes, they do work. So the difference between over-the-counter bleaching products and what we can do in office is just the concentration and the strength of the bleaching products that we have in office. So yes, they do work, but only to a certain point of bleaching. And then if you want to go even further than that, in-office bleaching trays can be an option.
I know when I do whitening and stuff like that, it makes my teeth sensitive. So if that happens, what should people do?
So if you're having sensitivity, you can get sensitive toothpaste that has a certain ingredient that helps with sensitivity. And I would also just take a break from bleaching until your sensitivity resolves. And then when it does, you can continue to bleach.